EMTALA is the Emergency Medical Treatment and Labor Act, which requires that emergency departments and hospitals provide a medical screening examination to any patient who enters the emergency department requesting such an examination. Additionally, it prohibits hospitals with emergency departments from refusing to examine or treat any patient with an emergency medical condition.
Hi, I think I broke my arm skiing. Can you help me?
Yes, we just need you to fill out this paperwork, and then after that, we can get ready to see a doctor.
Okay, thank you so much. I filled out all the paperwork, but I just don't have insurance. Is there any way you could still take me? Because this is an emergency.
Unfortunately, without insurance, we can't take you, but if you have $50, you can put a down payment, and then we can get you a screening.
Okay. I don't have any money with me.
I'm so sorry. Maybe you could just go to another hospital because it's kind of our rule that you have to have health insurance, so we can't help you here.
Hi, I think I broke my arm. I need to see a doctor, but I don't have insurance.
No problem. If you could just fill out this paperwork and then just leave the insurance part blank, and then we can call you for a doctor to see.
Okay, thank you so much.
The certification and compliance for the Emergency Medical Treatment and Labor Act states that medical screening, examination, and/or stabilizing treatment is not to be delayed in order to inquire about payment status.
Hi, thank you for coming in today. Unfortunately, your cancer has spread to your throat and it's caused major damage. I can no longer be your physician anymore because it's outside of my training. You're gonna have to speak with another doctor. There is somebody on South Don that you can call, but you have to call yourself and speak with them.
Can I have a reference? I don't know.
You're gonna have to call them yourself. Hi, thank you for coming in today. Unfortunately, your cancer has spread to your throat and it's caused major damage. I can no longer be your physician anymore, but I can show you a list of throat doctors that you can pick which one you prefer, and after that, I can properly transfer you to another facility before I discharge you.
Okay, awesome. Thank you.
If hospitals do not have the capability to treat the condition, the hospital must make an appropriate transfer of the patient to another hospital with such capability. That includes long-term care or rehabilitation facilities of patients unable to provide self-care. Hospitals with specialized capabilities must accept transfers and may not discharge a patient until the condition is resolved and the patient is able to provide self-care or is transferred to another facility.
Hi, this is my friend. She needs to seek medical help immediately. She's experiencing heart attack symptoms, it seems like.
Okay, we'll get her back to the doctor immediately.
Okay, thank you.
Hey, I'm here to check your vitals. So. Give me hello? Yeah, what's up? Hey, your vitals checked out, so here's some medicine, and then you're just good to go.
All right, it looks like you're doing better. We're gonna go ahead and get you to sign these discharge papers, and then you're good to go.
I don't know, I'm still not feeling good. My nurse was on her phone while she was taking my vitals.
All right, I'll go call somebody. Hi, can I get the administrator down here? EMTALA states that any person seeking care who has an emergency condition or is in active labor must be treated.
Nurse Avery, did you make sure that the patient was stabilized before you discharged her?
Yeah, I mean, I took her vitals and she was fine, so yeah.
Okay, well, the patient said that she was still having pains and that you improperly gave her vitals.
Well, I gave her medicine, so she should be fine.
Okay.
Hi, I'm gonna check your vitals. And I'm just gonna write something down and then give you some medicine.
Okay.
Alright, so we're gonna prescribe you some digoxin because it looks like you're having some heart palpitations and that should alleviate it.
Thank you. Alright, looks like you're completely stabilized, so we're gonna go ahead and get you discharged with these papers.
Okay, thank you.
EMTALA states that a patient cannot be discharged or transferred from a hospital until they are fully stable and all the symptoms of their condition has ceased.
Hi, my name is Paul. I've been transferred from the Auburn Hospital. They said they were at capacity.
I was not aware we were getting a new transfer patient, so I can't admit you right now.
What should I do?
I don't know. I can't help you.
Okay. Hi, my name is Paul. I've been transferred from the Auburn Hospital.
Okay, let me see if we got your paperwork. Oh yeah, we did. Here, fill out these forms and I'll admit you as soon as possible.
Perfect, thank you.
EMTALA ensures that a hospital cannot turn away a patient being transferred from a different hospital. The receiving facility must accept the transfer and have available space and qualified personnel to treat the patient.
Hi, my friend cut his arm. He's bleeding pretty bad. He needs help right away.
I'm so sorry, we're at full capacity. We can't take any more patients. We have no doctors that can help you. You have to go somewhere else.
I can't make it.
Sorry, we can't help you.
Hi, my friend cut his arm pretty bad, and I think he needs help right away.
I'm so sorry, we're at full capacity right now, but I can call a doctor to at least stop the bleeding if you guys want to go somewhere else after that.
Okay.
Okay, this will stop the bleeding and stabilize you, and then we'll send you somewhere else for further evaluation where they have more capacity, okay?
Okay, that's fine.
EMTALA states that any patient entering a hospital with an emergency condition must be stabilized even if they must transfer the patient. The hospital must receive and stabilize the patient, meaning that the patient will not experience any material deterioration between the transfer. Turning away the patient will result in a fine.
Hey, do we have any records for the John Warner? They came in the emergency room yesterday saying they were having difficulty breathing.
I can check the logs right now. I'm not seeing any record of John Warner in the logs from yesterday. Are you sure that they came in?
Yes, I'm positive. I'm the one who admitted them.
I'll check again and make sure I didn't miss anything. Let me just. I'm not seeing anything.
Well, they were admitted yesterday morning, and I discharged them last night.
I'm not seeing any record of John Warner.
Well, John Warner actually is suing me in the hospital because he said I didn't stabilize him before I discharged him, but I know I did.
Well, without the logs, I'm not sure there's anything I can do. I'm gonna have to notify the board.
Hey, do we have any records for John Warner? They came in the emergency room yesterday saying they were experiencing difficulty breathing.
I can check the logs right now, just one second. Yep, you're good. Everything you need from when he was admitted and discharged is recorded.
Perfect, thank you so much.
Maintain a central log of individuals who come to the dedicated emergency department seeking treatment and indicate whether these individuals refused treatment, were denied treatment, were treated, admitted, stabilized, and/or transferred, or were discharged.
My stomach really hurts. I think I need to be checked out. Can you help me?
Okay, yeah, just let me get your information. You'll fill this out.
Right. Here.
Well, apparently here it says that you're 16, and because you're a minor, we don't have the authorization to treat you.
Please, I really need help. It hurts really bad.
I'm so sorry, but we can't help you.
What seems to be the issue?
Well, this patient is complaining of pain in her lower right abdomen, but she's 16. She's a minor, so we can't treat her.
Oh, that's actually incorrect. We're actually allowed to treat minors in emergency situations, and we're legally obligated to treat them. She could be having appendicitis and need treatment immediately.
Oh, okay. Well, let me just get her admitted then so that she can start treatment.
Hi, I'm having stomach pains. Can I please be checked out?
Yeah, of course. Just fill out these forms and the doctor will take you back when you're ready.
Thank you.
When you're ready, you can follow me.
Emergency physician's duty to care for anyone, anytime, especially a minor.
My baby's having seizures. I need help.
I'll come take his vitals.
Okay.
Can you go see if we have any neurologists on call?
Yeah.
Do you need a list of doctors?
Yes, please. Thank you. Hi, Dr. Smith. I was wondering if you could come in and check on this patient. There's a baby that has just had a seizure. Okay. Okay. Okay, thank you. Okay, so I just spoke with Dr. Smith and he said he's not qualified to treat the baby. Do you know if there's any neurosurgeons on call?
Let me look. Unfortunately, I don't think we have anyone on call right now.
Okay. Hey, do you know if we have any neurologists on call?
Yes, I think so. The number should be right there.
Perfect, thank you so much.
You're welcome.
Hi, Dr. John. We've just had a baby come in who's been having seizures. Would you be able to come in and check him out? Perfect, thank you so much. I'll let the patient know. Hi, so we do have a neurologist on call and he said that he'll be down in a minute to come check on the baby.
Awesome. Thank you.
You're welcome.
EMTALA states that hospitals must maintain a list of physicians who are on call for duty after the initial examination to provide treatment necessary to stabilize an individual with an emergency medical condition.
My chest feels so tight I can't breathe.
Don't worry, we're gonna get you checked out with an EKG.
Okay, we're gonna set up this EKG and get an idea of what's going on.
This patient is having serious heart arrhythmia. We don't have the necessary equipment to treat her in the hospital.
Yeah, she needs to be transferred to Metro Hospital right away.
The patient needs to be transferred to Metro Hospital immediately. They're having shortness of breath and heart arrhythmias, and we don't have the necessary equipment to treat them here.
Well, my lunch break's in 20 minutes and I've already changed, so I think I'm just gonna come back later and fill out the paperwork to transfer.
Okay, I think it should be immediate.
I think it'll be okay.
I don't agree with that, but you're the doctor, I guess. Okay, we're gonna take you back now.
Oh, my chest!
Dr. Paul refused to sign off on a patient transfer and the patient collapsed in the hospital.
Oh, wow. Okay. I'll go talk to him about it. Dr. Paul, it brought to my attention that you refused to sign off on a transfer and the patient almost had a severe heart attack and almost didn't pull through.
Oh, I didn't know that that was gonna happen. My lunch break was 10 minutes away and I was hungry. I'm sorry.
Well, we just don't do that again.
Sounds good.
I need to report this to the board.
Hi, what can I help you with today?
We actually had an incident earlier with Dr. Paul. He refused to sign off on a transfer because he was close to his lunch break, and the patient actually had a severe heart attack in the lobby of the emergency room.
Oh no, yeah, that cannot happen, and we'll make sure to look at his future privileges with this hospital.
Okay.
EMTALA is active legislation enforceable by law created for the betterment of healthcare and patient outcomes.